Hello, everyone. Thank you for joining us today. We are honored to be starting the second part of our Abolition for Our People series, titled Cultivating Positive Justice, Ending HIV Criminalization Through Principled Coalition-Based Advocacy. And with each of these webinars, we're hoping to provide some background on the principles and practice behind an abolitionist approach, with the hopes that attendees will bring these principles and practices to their HIV decrim work, as well as beyond that, and bring us all closer to liberation. And during this week of World AIDS Day, we gather to reaffirm our commitment to ending punitive systems that target people living with HIV, especially Black, Brown, trans, femme, and immigrant people living with HIV, while also rededicating ourselves to building collective care that recognizes and promotes bodily autonomy, dignity, and justice for all. Before we get started with the substance of today, I'll take a few minutes to review and introduce our organization and the presentation. If you can introduce yourself in the chat by dropping your name, pronouns, and org, if you feel comfortable, we can start at that point. All right, we can transition to our slides, which will provide an overview of today's webinar. We'll be introducing the new Positive Justice Project principles. The Positive Justice Project is a core component of CHLP, which I'll talk about in a moment. Then we will explore the ways that these principles inform the work of HIV decriminalization advocates by speaking with a few folks during doing the work on the ground. And finally, we'll have some time to discuss some remaining questions that y'all have. We'll also have a moderated discussion with our panelists. In case you're unfamiliar with our small but mighty PJP team, in addition to myself, my name is Sean McCormick. I'm a staff attorney. We are led by Senior PJP Attorney Jada Hicks and Public Health and Advocacy Strategist Katira Epps. They will be joining me in a few minutes to talk more specifics about the principles. For folks that are just joining us for the first time today, CHLP is a multiracial organization that uses a queer Black feminist lens to analyze the issues of discrimination, criminalization, and oppression of people living with and deeply impacted by HIV and other stigmatized health conditions. HIV criminalization represents just a facet of the broader oppression facing people living with HIV and deeply impacted by HIV, especially Black folks, LGBTQ people, working class communities, people who use drugs, people who engage in sex work. And although our name focuses on HIV, we acknowledge that many people living with other conditions, such as viral hepatitis and other STIs, are punished with severe criminal and other consequences based on their health status. We envision a world free from state violence, where people are not dehumanized and punished for their real or perceived identities, and where health conditions are not met with criminalization and surveillance, but rather resources and support for people to thrive. In 2025, CHLP is celebrating 20 years of making positive justice possible. From its inception, we've worked in close partnership with HIV advocates and prioritized the impact of HIV on LGBTQ plus people and Black and Brown communities. Next Thursday, on December 11th, we will be launching our new strategic plan, actually, which charts our past journey and offers a roadmap for this current moment. The event will provide an overview of the strategic planning process and will feature reflections from several people who played key roles in shaping it. We'll share the link for that so y'all can sign up. As I mentioned, the Positive Justice Project is a core component of CHLP's work. PJP works with state and local coalitions of people living with HIV, advocates, researchers, nonprofit leaders, government officials, and other stakeholders. Through this work, CHLP supports federal and local advocacy efforts and education efforts, including mobilizing advocates, organizing and strategizing with coalitions, educating stakeholders and policymakers, and drafting policy and advocacy resources. About 15 years ago, PJP was launched, and in 2015, the PJP guiding principles were first introduced. They called for reform of harsh criminal laws that specifically and only target the behavior of people living with HIV. But with the years, CHLP, as well as the work of PJP specifically, has changed significantly, guided by our executive director, Mandisa Moore-O'Neill. CHLP substantially redesigned its mission, vision, and values, and we've seen that philosophical shift play out in a lot of the PJP coalition work that we do, whether it's in building relationships with local advocates, drafting legislation, or any of the other work that we do. So in response to that change that we've seen, the PJP team initiated a process of reimagining the PJP principles in the summer of 2025. We internally discussed the purposes and design of the principles, and over the next year or so, we very painstakingly examined every word and phrase to develop a draft for internal review, and met with the newly assembled PJP Partners Group, which provided critical feedback on that language and offered some potential ideas for how to apply these principles. Earlier this week, we published those principles online, and I hope folks have been able to explore them. We'll also share them in the chat and then use this as an opportunity to talk a little bit more about the ins and outs of them. But before we dive into specifics, I want to take a moment to, of course, convey our immense gratitude to the people who were involved with this process, Shayna Turner, who offered us a lot of grace and wisdom during the process, as well as the PJP Partners Group, who provided their careful feedback. And of course, thank you to Dee Resnick, our resident comms expert, who edited and formatted the principles and supported this entire webinar and a lot of our this series as well. Diving right in, you'll see that the PJP principles are divided into a preamble and 3 principles. The preamble begins by calling for an end to laws and policies that criminalize people living with HIV and other stigmatized health conditions, while at the same time building out opportunities for people to live and thrive according to their own terms. As I'll spell out later in the 3rd principles, we also state that a public health approach that's grounded in liberation to achieve health equity should be used to address public health concerns. As we think about World AIDS Day, the preamble reminds us about what is required for liberation. It's more than just an end to carceral laws that target people living with HIV and other stigmatized health conditions, but it's also vital to build up systems that allow people to make their own decisions regarding their well-being. A later portion of the preamble describes how these principles acknowledge and center the communities most impacted by these oppressive systems, especially people who have been particularly marginalized due to their intersecting identities, like Black women and LGBTQ plus people of color. This portion of the preamble really articulates our approach as a queer Black feminist organization. Our perspective has been firmly shaped by the communities who have been most impacted by multiple interlocking systems of oppression, but especially Black and brown queer women. We understand that the law, including HIV criminalization laws, have been used to otherize, stigmatize, and punish these identities. And with these principles, we aim to articulate our focus on being informed by this historical and ongoing reality. We bring this distinct analysis to every issue that we attempt to tackle through our work. And with the final section of this preamble, we outline some of the possibilities for these principles. More than just guiding our internal operations, we hope that the principles inform people of our approach and inspire advocates both on the national and state level to move forward grounded in a liberation framework. We also hope that they promote accountability by spelling out the standard that we and other people should live up to. Today, these principles are especially vital for this purpose. In a moment of increasing criminalization, surveillance, and divestment, our values have to guide how we show up and how we lead. At this point, I'll pass it over to Senior PJP Attorney Jada Hicks, who will provide an overview of Principle 1.
Thank you so much, Sean. So jumping right into Principle 1. So the Positive Justice Project is grounded in an abolitionist commitment to ending the criminalization of people based on their health status. At the center of principle number 1 is something very simple and at the heart of PJP's work, that having a health condition should never be treated as a crime. Laws that target people with HIV or people living with any other stigmatized health condition expand the reach of policing, surveillance, and punishment. So they take away people's bodily autonomy and they do nothing to support actual public health. Because our ultimate goal as an abolitionist organization is repeal, repeal is the clearest way to remove the state's power to arrest, prosecute, incarcerate, or register someone because of their health status. We have a commitment to reducing the size, scope, and harm of the criminal legal system. But we also know and acknowledge that full repeal is not always immediately possible, especially in political environments that are hostile to public health, to bodily autonomy, and to people living with HIV and other stigmatized health conditions. When we can't repeal a law, we work to reduce the harm that it causes. That can mean narrowing who the law applies to, limiting the situations where someone can be charged, or reducing the penalties people face under the criminal law. These reforms can make a real difference in people's lives, especially for those who are currently at risk of prosecution. However, we need to be cautious when reforming a law and aware of any unintended consequences. A reform that looks like progress can sometimes reinforce or even expand the reach of the criminal legal system. One example we see often is when an HIV-specific criminal law gets reformed and it's rewritten so it no longer specifically mentions HIV by name, but instead applies, say, to a communicable disease. That language you could use interchangeably with sexually transmitted disease, venereal disease, but the core is that HIV is no longer specifically named and a broader communicable disease or other term is named in the statutory language. On the surface, this feels like a win. HIV is no longer singled out. But in practice, that change actually broadens who can be criminalized. And depending on that language that's used to define communicable disease in the law, it can cast an extremely wide net. So it can sweep in people living with hepatitis, with tuberculosis, and even sometimes potentially with something like COVID-19. So yes, the law may feel less stigmatizing for people living with HIV, but it can now be used against a much larger group of people. I also want to point out that this is something we are learning as we continue in this movement and we grow not only as a team for PJP, but just in our work in the HIV decriminalization space. So learning from actually passing reforms and then seeing how it affects individuals after the reform has been passed and how we then take those lessons and incorporate it into our work to make any sort of reform stronger and reduce the most amount of harm as possible. And that's why our abolitionist lens is essential. It keeps us focused on the long-term goal of eliminating criminalization tied to health status altogether, while helping us not craft reforms that might unintentionally expand state power. Another important piece of this work is recognizing that HIV criminalization doesn't only happen under HIV-specific statutes. So people living with HIV are also prosecuted under general criminal laws, laws such as assault, aggravated assault, or even sometimes aggravated sexual assault. And this is where prosecutors argue that the bodily fluids of a person living with HIV are deadly weapons. These prosecutions can carry extremely harsh penalties, even in states that don't have HIV-specific criminal laws. So another strategy we use when repeal is not immediately possible is to try and reform the general criminal code in ways that reduce the number of people living with HIV who can be charged under these broader statutes. An example that I often name is from Texas. Over the years, Texas advocates have pushed for legislation that clarifies that the transmission of bodily fluids by a person living with HIV does not constitute the use of a deadly weapon for the purposes of prosecuting aggravated assault or aggravated sexual assault. Eliminating this deadly weapon argument reduces exposure to severe sentencing, limits prosecutorial overreach, and chips away at the broader set of laws used to criminalize HIV outside of HIV-specific statutes. And while this is not repeal, it does meaningfully reduce harm and help shrink the avenues prosecutors have historically used to target people living with HIV. All these pieces fit together. So repeal where possible, harm reduction reforms when repeal isn't yet achievable, and carefully crafted reforms to the general criminal code that reduce opportunities for prosecutors to weaponize someone's health status against them. Each of these strategies that I've discussed moves us closer to the end goal of ending the criminalization of someone's health status and building systems grounded in care, bodily autonomy, and collective well-being. I will now pass it to Katira Epps to jump into principle number 2.
Thanks, Jada. All right. So principle number 2 really kind of explains how we show up in coalitions with partners and sets an expectation for ourselves on how we show up, but also how we practice our abolitionist framework as well. So we don't swoop in and appoint ourselves as leaders in coalitions. Coalitions already have leaders who are working on the ground, who are representing the most marginalized, who are criminalized by these laws directly. So we usually are invited and we follow the lead of the advocates and coalition leaders. However, just like when you get a group of folks together from different walks of life, there can be conflict. There can be, especially around legislative strategy and how you want to go about repealing or reforming these laws. However, I think like in that conflict, this is where we can build the trust that we're talking about in principle 2. That you can trust that CHLP has these principles that we follow and hope to be held accountable to, as well as serve as a North Star as well for coalitions and how they do their work as well. So yeah, you can trust that we are advocating for the most affected by criminalization and that we are all sharing the same goal of eradicating criminalization of our people. And we also want coalition members to use these principles as well as their guiding light. So coalition members, leaders can have that courage to like speak up when erasure happens. And we know that if anyone's ever done legislative work around HIV criminalization, when you bring up certain topics or groups such as people who engage in sex work, people who use drugs, viral hepatitis, it can be a no-go, like door slammed in your face by some legislators. And so we want to make sure that we're not invisibilizing these people or throwing them under the bus to get a repeal or reform, because we can't have a group of people that are designated as these are people are okay to be criminalized because we don't necessarily agree with their lifestyle, or these type of people, they shouldn't be criminalized, and kind of doing this exceptionalism for certain groups of people, because no one should be criminalized because of their health status. So yeah, and so we encourage coalition members to use these principles as well to push back when they're talking to potential sponsors, legislators, to say like, hey, we know this may be unpopular, but we also don't want to be silent in this erasure, and not be complicit. And I think that's really important in today's world, where we're seeing a lot of people kind of be complicit in these changes, all due to fear. And so, yeah, I think like this principle really highlights us wanting to center and follow the leadership of those marginalized. And I want to point out that part of our commitment is attacking criminalization in all its forms. So not just HIV or communicable diseases, but also any policies or laws that attack the bodily autonomy of our people. And so I wanted to point out that we just published through Scallywag Magazine an article about the criminalization of HIV and how it relates to state violence. Those of you who are in the Louisiana Coalition may find a lot of the examples I approved in the article to be familiar. And it really ties together how the criminalization of HIV is just kind of the canary in the coal mine of a greater environment of criminalization, particularly of Black Southern folks. So yeah, please read. And I think that is all for me for Principle 2. And so we're going to go back to Sean, and he's going to take us home with Principle 3.
Thank you, Katira. Really excited about that new article, which provides a useful analysis, especially in this moment. And with the third principle, it's a description of a recognition of the harms of criminalization, especially on public health. And these harms, of course, are well documented. When it comes to HIV criminalization, these harms appear across the care continuum, whether it's in prevention, testing, or treatment efforts. For example, we know that criminal laws target people who are knowledgeable of their status, which creates a clear disincentive for people getting tested and becoming aware of their status. And criminal legal involvement is extremely disruptive for HIV care for people living with HIV. It means it's harder to access the medication you need, more challenging to access social and other services, mentally and emotionally distressing, and beyond incarceration, of course. That means that you have a criminal record that limits the access to tons of different government benefits and social and political rights. But we don't need those specific peer review studies or some high-powered journal to articulate that HIV criminalization harms our communities in many different ways. It dehumanizes people, it stigmatizes people, it pushes people into the criminal legal system. Those harms are well documented, and we know them even outside of any public health research. But importantly, this principle clearly rejects any alleged public health approach that basically perpetuates the carceral punishment that we've seen in the criminal legal system by denying the dignity and autonomy of people living with HIV and other stigmatized health conditions. We have to remember that these laws were enacted and continue to be defended based on public health terms, and these principles flatly reject that supposed public health justification. Any approach that dehumanizes and stigmatizes people is ineffective, no matter how it's purportedly helpful in addressing new transmissions. Instead, the principle calls for a public health approach that is liberatory. It advocates for systems that provide resources and support for people to achieve their vision of health and happiness. And during the week of World AIDS Day, the principle reminds us that all efforts to end the epidemic must be grounded in bringing us closer to justice for people living with and impacted by HIV. What does that mean? It means broader and more comprehensive sex education, wider availability and greater affordability of prevention methods such as injectable PrEP, expanded access to care that is competent and compassionate. And we've seen this movement to be more broader in decrim campaigns in several of our state coalitions. For example, folks might be aware that Maryland just repealed one of its HIV-specific offenses. With the next phase, they're hoping to expand access to PrEP within pharmacies and reduce some of the affordability concerns. We've also seen in Louisiana, legislators seek to understand the broad causes of ongoing STI transmissions. And with the task force, they've pointed to the need for more evidence-based education, as well as expanded testing, at the same time of acknowledging the harms of their HIV criminalization law, the exposure law in Louisiana. These types of programs allow people to take charge of their health, engage with and stay connected to care, and discuss sexual health with providers, partners, and loved ones, and overall make decisions about how they are going to achieve their own vision of health and happiness. So thank y'all for your attention during this period of explaining and reviewing the principles. At this point, we are honored to be joined by several advocates who are fighting to end HIV criminalization and other oppression, and as well as build systems of care and compassion for people living with and impacted by HIV. They hopefully will share how they've implemented some aspects of these principles within their work and in the HIV justice movement. And I'll take a moment to briefly introduce them, and then we'll turn to some questions that we have for them. Cole McAfee is the executive director of Freedom Oklahoma, which works to build an Oklahoma where all 2S LGBTQ plus people have the safety, community, and resources to thrive. Max Boykin is the movement director of Black South Rising, which fights to build political and community power for Black Southerners and transform systems that have caused disproportionate harm on Black Southerners. And Naima Sanchez is a senior organizer in Philadelphia, where she works to break down barriers to care and well-being and develop systems that bring justice for transgender people. She is also the world's first trans laureate. So congratulations, Naima. She was recently publicly awarded that significant award. So thank you all for joining us today. I want to start with a little bit of intros to abolition, and take a moment to introduce yourself, however you would prefer to do that. But can you share some of your initial understandings of abolition and how you began to tie abolition to the work you've been doing in justice or HIV decriminalization? And please feel free to jump right in whenever you're ready.
Well, I guess I'll go first. Hi, everyone. Naima Sanchez once again. And so for me, abolition, the first time I ever, heard about abolition, it was from my great granny who was from Macon, Georgia. And she talked about the stories of how abolition came into the conversation of enslavement, but how the 13th Amendment of the U.S. Constitution still permits slavery or enslavement of folks by criminalization. And so that's how it really showed up for me in my life, as far as like in context of learning about it. But how I created is by really addressing like conditions where punishment and policing and cages are no longer like the default response to like harm and survival. It is like my personal commitment to like working to build systems that actually keep people whole, and not criminalize them for how they show up or who they are. And so really I come to this conversation as a proud out trans person, but also as someone who has an experience around sex work. And in Pennsylvania, however, HIV is not criminalized. Engaging in sex work while being someone who is living with HIV can be. And so that's how I'm showing up in this conversation as it pertains to Pennsylvania, but also how abolition shows up in my life and my first context of it.
I didn't know if it was going to be me or Cole next. But hey, y'all. Max Boyd can hear me his pronouns. Repping Black South Rising. I know many of you also know me from the Save HIV Funding campaign. And it's a pleasure to be here. Come on, Macon, Georgia. Thanks for that shout out. I'm from right outside of Atlanta, Georgia. And but my introduction to abolition, abolitionist politic and framework came in Chicago. I was an organizer there at the time, working for AIDS Foundation of Chicago, but also a member of Black Youth Project 100, which is a group of 18 to 35-year-old organizers, activists, young folks fighting for Black liberation through a Black queer feminist lens. And that was actually my first time really of understanding and hearing actually the framework of abolition and its context around the prison industrial complex, and understanding how, you know, the continued policing of folks and for us to be able to end police violence, for the way the prison industrial system continues to impact our communities. The only way is for us to really do that is through an abolitionist framework. It wasn't hiring more Black cops. It wasn't trying to, you know, just train our way of making the police better for us. And I sat at this intersection of, we were trying to work on modernizing the HIV criminalization law in Illinois, which at that time still had a law in the books that was one of the worst ones, I really say, at that time in the country, in what was considered, you know, a more progressive state and progressive, you know, city centers such as Chicago. And what I learned within this particular time was there was a different understanding of like thoughts and beliefs of even what abolition could be, what decriminalization looks like. And there was another thing as a organizer who works to change policies historically in my work, you know, non-reformist reform. Shout out to Marion Kaba for also like giving us those language to actually understand like what this could look like, and what abolition could be in these spaces. So bringing that into what was Illinois ASAP, which were leaders across the state of Illinois, included many people living with HIV, and hearing what I first had to really hear what they were going through and what they actually wanted to see. And there was, you know, we had a coalition of folks, you know, working on this. But with that, one of the things that we learned was there was a difference of opinion from the community that was most impacted versus what some of the, you know, national orgs were talking about, or even local orgs at that time as well. And what we had to do is do an intense space of education internally within the coalition, but also within, and as I always said, we got to continue to engage community around this. And then I'll tie this back a little bit later also to Black South Rising, but like some of the things that we're also, you know, trying to do is, as a person who moved back to where I'm from, right outside of Atlanta, and really organizing, you know, a lot of folks in the South, was also understanding the different barriers that folks had, and trying to also continue to educate, advocate, and, you know, around what can be, because some folks just don't know what is possible when it comes down to dealing with the police and prison systems, and to really understand having this like focused around our health is one of the key things. So being able to do that and continue to engage that in this abolitionist politic across the country, but definitely where it's hardest hit, is something that I truly do enjoy to do.
I should have known it was a bad call to go after Naima and Max. But yeah, Nicole Cole McAfee. I use they and she pronouns. I am the executive director at Freedom Oklahoma. And for me, I think that abolition really became something I dug into as a concept in practice when I was working at the ACLU of Oklahoma. I was there during Campaign for Smart Justice years, which was an effort focused on decarceration, but also looking at uh, the way that racism shows up in the criminal punishment system. And the deeper I worked around the criminal punishment system and reform approaches, the more I think that I personally understood that like you could not remove the racism from a system that is built on racism. Um, I was also lucky to start following Miriam Kaba on Twitter back before Twitter was the dumpster fire that it is today. And she really opened up my mind to a lot of different thoughts about abolition as not just sort of an undoing, but thinking about how we respond to harm with compassion, care, and restoration rather than with more harm and punishment. And so for me, that came with me as I moved into my role at Freedom Oklahoma, which didn't start out as an abolitionist organization. It's an org, right, where in its beginning, there was efforts to expand the criminal punishment system in response to harm to us LGBTQ plus people. And I'm really lucky to get to work in communities where we are unpacking that and changing that approach. And really grateful, I think, especially as we talk about this in a lens around HIV modernization work, to like work alongside orgs like CHLP and with folks like Michael Elizabeth at Equality Federation, who are really proactively talking about not only like how we do this work in a way that is achievable, but also in a way that thinks about long-term impact and how we bring abolitionist lenses and values to the approach.
Thanks, y'all, for sharing that background, because I think it's very helpful to illuminate where everyone's coming from, because, you know, nobody has arrived to this moment without learning from great mentors or people in the movement, especially, you know, Miriam Kaba, and we had Andrea Ritchie on our first webinar too. I can definitely speak to them being very influential in my own perspectives. You know, and from that, we learned some of the theoretical foundations of abolition. And this conversation that we're having today, hopefully will move towards practice, and especially with those PJP principles that we introduced, building on those as an example of abolitionist principles in the practice. What does it look like to apply those principles to HIV decrim or reform in your work, and what sort of tensions have you encountered or navigated in trying to apply those principles? I think we've all come up with some challenging moments, and we've tried to work through them. So I would love to have you all share some of those that come to mind.
I can start on this one. So, right, I don't think anyone thinks of Oklahoma as an easy place to do any work around the criminal punishment system. And we are definitely up against a lot of barriers when we think about policy change. Right, we have a supermajority Republican membership in the legislature. All of our statewide elected positions are held by Republicans. Like we are, when we think about policy change, like not starting the conversation with people who share values around abolition, much less values around even sort of more moderate versions of policies we might think of. And so I think for us, some of the things that have been really important in thinking about tensions is one, just like being clear in what our goals are. For us, it's really important that we don't start from a place where we are compromising on behalf of anyone, but particularly the people most marginalized and excluded. That the policy process calls for compromise, and it is not serving our communities or our work to start from a place where we are already compromising on our values and on behalf of community members. So I think that that has been really critical. It has led us to create a repeal and repair framework. So talking about our efforts around HIV modernization in a repeal and not a reform lens has been critical, I think, to digging into some of those tensions and like honoring them while honoring our values. And to also think about the repair pieces, that like I think some of the tensions that we find in this work is not only with folks that we think of as sort of our automatic list of who might be opposed to this reform, but when we think about tensions that exist within community and the way that so many members of our community have bought into the punishment system as a response, and have had to survive. And so I think that the repair lens has been really helpful for us too, in having those conversations in ways that think about how we are addressing the harm of people who have been harmed by these systems, as we are thinking about a more holistic approach that doesn't only think about the like forward piece of this trajectory and how we try to take this off the books, but also how we grapple with the fact that people have been and continue to be harmed by the fact that these laws are on the books. And so I think, right, doing TWIS LGBTQ plus work in Oklahoma means that there are always tensions in how and where we show up. And for us, it is a matter of honoring those tensions and starting out from a place where we are clear about our values and clear about how we're showing up and why we're showing up. And that we find, even in spaces where folks may disagree or those tensions still exist, that they don't exist in a way that we are complicit in furthering harm.
I mean, I definitely agree what Cole just shared. I think I feel for me like putting abolition into practice really means centering the dignity and self determination of those who are directly experienced around the issue, right? And we see so often that folks mean well, there's good intentions, but it comes from a savior mentality that excludes the voices of those who are directly connected to the issue. And so I feel like the principles like help push us towards like an approach that moves power back into the hands of the community. And in my work, it looks like refusing like the fear-based messaging, rejecting the forms of like reforms that expand like surveillance and staying grounded in like healing and collective care, which is really important. And I think Cole shared that as well, is that having these guiding principles and values help reduce the impact that the tensions have in these coalition spaces as we work to overall liberate our communities from a specific issue, right? And I'm like, I mean, in Pennsylvania, I shared this earlier, is that HIV is not criminalized. It is only criminalized by like sentencing statute. So it is not you are criminalized for being a person living with HIV. However, if you are arrested for engaging in sex work, and in Pennsylvania, the statute is prostitution or solicitation or obstruction of highway or loitering, all of those things could be escalated from something that could be as simple as summary to a felony charge. It also ties into like domestic violence and separation of partners when one partner is a person who is living with HIV and the other one is not. And so I feel like the tension in a lot of these things, excuse me, my thing is ringing, that the tension comes in a lot of the coalition spaces because there are folks who are willing to settle for what reforms looks like, which really is like making it more gentler for them to expand the reach of criminalization, right? There's like always in some, well, I don't want to say always, but there are folks who feel the pressure to just compromise because the work is too in depth, right? It challenges some of our own biases, and even for folks who are not deeply connected to HIV, that it challenges those ways in which like either like racism shows up or the savior complex shows up. But like Cole says, having those guiding principles and values help move us along, right? Getting us geared back to, okay, this is something that is challenging. This prevents a barrier, but these are our guiding principles. So how do we get from point A to point C without allowing the tension of point B to I don't know, disrupt the whole desire to liberate our communities from HIV criminalization, right?
Yeah, I agree with everything both Naima and Cole said. For me, another thing that I had to think about was, definitely not to center myself. I'm not the most important person within any of this at all. I'm not the person living with HIV. I also had to understand that just because someone is a person living with HIV doesn't mean that they have the same philosophical beliefs. Don't mean that they came up in the same way. So there's also going to be a difference of opinion within that. One thing I've always understood, two things that I definitely like to learn from it is, one, make sure that you do have folks from different communities coming in. One of the things I had to make sure that we were able to do early on was like make sure that sex workers or people who have done sex work are in the room. We had to make sure the Harm Reduction Prison Coalition, which was very instrumental for a lot of this work that we had done in Illinois, was also in the room because they also had returning citizens to be able to talk about like some of the struggles that they had also within the prison system. There was also the importance of course, having folks from different parts of the state to be able to also address some of this. Where I also struggled, was, when I went back south, went back home, I thought I could, take a lot of strategies I had from Chicago and do the same thing. And they were like, whoa there. This ain't that. This is the South. And, we're thinking, I'm like, we got the legislators. We actually had, to me, more legislators like lined up than I had in Illinois. But that conservative backlash is different. And also the way in which the media is also used within this is always going to be a problem. And that's important to think about when any HIV criminalization case does come up, is how media talks about the cases, how they sensationalize it, and also use very outdated language. And many times that they do that, and that can always hurt and sometimes help, but many times it hurts our case in a lot of ways. So being able to also have the engagement with media in a real way to be able to think about like how we're changing the narrative around this. And some of the earlier pieces for me was not the direct engagement with legislators. It was direct engagement with community and media outlets to be able to help change that narrative around it, because you needed them to be able to help change it, to get even legislators who are reading those media outlets and listening to community to start to understand what is actually possible and why these laws on the books are a problem. So that was, and starting with that strategy and doing more of that community engagement, more of the engaging with folks that are directly impacted, but also some communities that aren't directly impacted, to get them in the room to be able to have some of those conversations. But also, as these principles also lay out, is making sure that you're sending the most people impacted and understanding what that truly looks like for the state or the local entity that you're engaging.
Thank you all for those responses. I think, Max, to a point that you brought up earlier, maybe I'll direct this to everyone if you care to answer. And in particular, you mentioned reformist reform. So a question that we've always thought about is dealing with priorities and politics that may differ within coalition spaces. What have y'all learned about sustaining abolitionist principles in collaborative organizing spaces, especially when partners, funders, other folks may push for more mainstream incremental approaches or reformist reform that doesn't actually seek to be transformative and is not abolitionist? How do you navigate that that situation? And maybe Max, if you feel comfortable talking about what reformist reform means.
Yeah, so when I say non-reformist reforms, it's a theory or strategy that thinks around, we want to make whatever laws that are getting passed in the book to ultimately get to and abolish the harmful systems that are actually pushed. That is not necessarily always the case with non-reformist reforms. So sometimes you're just trying to undermine or shrink the impact of how bad these crappy laws can be. That's really what I'm saying. Non-reformist reforms is trying to create laws that don't add more harm later on, and it is part of like a larger harm reduction strategy. But but it's sometimes hard to actually like understand what a non-reformist reform is, and understand like how in which to how to get to that space. One of the things I'll say, like what I've learned within this is, again, making sure that the community that most impacted is actually like heard fully within it. That's like very first most. Is like, even if, and sometimes though will be more like reformist reforms. But if that is also what they are asking to do, I have to, I will put my ego and privilege aside and understands like, okay, this is also what they're trying to ask for. And we did see that with the Georgia modernization bill when I was a part of that as well. I also want to say though, when particularly at times some of like the reformist policies, like, oh, we just trying to get a win. And this will get us how we want to be able to get to the next level. And then we'll be able to build off of it. A lot of those times that actually isn't what happens, and we lose some of the momentum when we do that with reformers because people don't feel as connected with the policy, and it ultimately, because of what I always say is the worry that we have is the counterpunch from conservative folks is like, oh, we'll get a win, and then that counterpunch is like, that'll knock out our win and wins from the pass out. And being able to also predict and think through how in which that goes. I also just want to say, a lot of people that play the inside game, and this is a person who plays and straddles the inside outside game of policy reform, is a lot of the folks that do the inside game are going to play it very safe. And I also have to at times like call that out and also make sure it's like, that's not necessarily always the best way for our larger wins and connecting it to other intersectional issues. If we're not also understanding how this is going to impact some of the other like legal abuse around like how people are being criminalized in general, how folks are dealing with different things in the prison system, and also just how HIV care is done within both in and out of the system, I think that then we're missing some points there as well. So it is doing more of the research and understanding how in which folks are, also hearing and lead, like honestly taking it from the folks that are most impacted, and also doing the improper education of what really non-reformist reforms is, and also like what we're doing right here with the webinar series of also people having better options and understanding what abolition truly is and what it can look like.
You know, Max, you said something earlier, and we were talking about bringing folks in the room. And I personally feel like coalition spaces are beautiful possibilities, right? And it's having a different perspective, a different viewpoint, vantage point over the work that we are collectively doing. And also having different mindsets always, leaves for opportunity for conflict. And what has helped me in like being transparent about like my like either political grounding is like starting off from the start with being clear and concise about my position. Like when the folks reached out to me about presenting this panel, I wear so many hats in the community, right? Like I work at this one large civil rights organization. I'm also on the board of a different org. I'm also a community member, right? I'm a person who leads from personal experience, right? And so I try to be clear and concise about me and how I'm showing up in the space, but also be very aware about in other places in which I represent, right? But also I think for me, which is where really has been beneficial over the years, is that I'm not afraid to like slow things down in rooms if I think that we're like moving to approach that harms people that we're claiming to protect, right? And so as an organizer, and this is something that my granny and my great granny like instilled in me, is that we should be prepared to do scenario-based strategizing, right? Because there is always going to be a hiccup in the road. And so creating those scenarios pre-issue eliminates those opportunities for the extreme slowdown of stopping and movement work, right? I learned that like sustaining like the abolition inside coalition works requires that is I have to be patient, right? Like I come from like I'm experienced that like when I first came into movement space, I wanted it now. Like I thought like the work, if I came in and I raised my voice, that I'm gonna get change now, right? And so having that patience or having patience in the process, right? Again, it's that clear communication and man, in so many coalition spaces that isn't had, right? It's like we do have a goal and we want to achieve that goal, but there's not clear communication or concise communications about how we get there. And again, like I say, like having this courage to like name when a proposed strategy, even if we came to a collective input about that strategy, reinforces that same systems that we're saying, Jesus, my boss is like calling me. It reinforces those like same systems that we're trying to dismantle if we are not paying attention of the political climate or other partners who are doing the work without us or without being intentional about joining these coalition spaces. And I think finally for me, I feel like building these relationships with individuals that we're at the tables with are very important because those deepened relationships allow us the opportunity to hold those hard conversations without breaking that trust or creating so much distraction from the actual issue that we're focusing on our personal issues of me saying, let me gently hold your hand as I say, I feel like this is going to be a problem for our community, right? And so I think that those are some of the principles that I hold into like abolition work or any type of movement work when I go into coalition spaces that help sustain and minimize those impacts.
Yeah, I think really want to echo the like clarity piece, like being clear on values up front has been like really helpful. I think that also the like reminder that I have to offer myself often is that like if we want to practice abolition in policy, that we also have to practice abolition like within coalition and within community. I think one of the pieces for me too that has been really helpful there is thinking about just the like learning, education, and imagination piece that like we all shared that we came to abolition in different ways at different times. And I try to make space for the fact that as much as I would like everyone to be at the like, okay, the system isn't working and we need to do something better, that like it takes different things for people to get there. And so one of the things that I get to do is in part of an organizing collective in Oklahoma called Home Base Oklahoma. And like we did reading groups and podcasts along with the reading around the Black radical tradition and just like understanding the carceral system this year to try to meet folks where they're at and having those aha moments in discussion where people are like, I've never thought of myself as an abolitionist, but I may now. I think it is a part of the work. I also think it's helpful in coalition to acknowledge and like name when it is useful for folks to come at an issue from different perspectives. Um, that like it can be helpful to have the more radical push to get to like a compromise that might be better otherwise, right? For folks to be able to intentionally like inside outside game an approach to change. I think it can be helpful too to like remind ourselves that in this work, like there aren't permanent allies or permanent enemies, just permanent interests, that like we are doing liberation work, and that means that like we are going to walk with other people in that journey at different times, and like sometimes folks may not be there with us, and that they don't have to be there with us in every part of it to like do the work and build relationship towards the longer term effort. And I think that like particularly on the funders piece of it, just to name that that's hard. Like we are in a time where funding is hard for everyone, particularly in the spaces where folks are leading from our values, where we are doing work in places where the wins are not quick or easy. But for us, it has been important to name that like one of our values that we share is that we will forsake funding and popularity in order to not compromise on behalf of community, especially those most historically and presently excluded and marginalized. So that is clear, like with our team, with our board and our broader community, as well as with funders, that like if we have a funding relationship and they're asking us to like engage in a compromise that is going to harm folks who are already most harmed, that like that is a hard line for us. And so I think that like part of this practice for us is having values-based and abolitionist conversations like in all parts of our work, and not saying that like that only applies to our community work but not our funding work. That like for us it is building that engagement across the board.
Yeah, it's something that I think a lot of people come to terms with, you know, as they go through that personal evolution in becoming an abolitionist or just grappling with the ideas, is that it informs many different aspects of nonprofit work, but just general work and moving through the world and how we process and understand issues. So thank you all for those very, very insightful responses. I want to take the lead from something that y'all mentioned. Naima, you mentioned, you know, the promise of coalitions and those varied perspectives and how they can actually be kind of a resource to persuade and advocate. How do we make space for varied perspectives, but especially for people most impacted, people who are trans, people who use drugs, people who engage in sex work in Black and Brown communities? How do we make space for them to lead this work and define what safety and justice means for them?
Well, I mean, the work is not real unless the people who are directly experienced are actually leading. And so when it comes to HIV criminalization, I think the reality that having people who are living with HIV, who are trans, who are sex workers, Black and Brown communities are at the center of not just the conversation, or just inviting us to the table, but I also feel like it's like making space of like shifting your resources, not just having it just like, oh, I opened the door and you're welcome to come to this table kind of thing. It means like paying the people for their labor, right? You're inviting them to speak and paying them. You know, I see a lot of times as a public person is that it's so often that folks who are directly experienced, who don't have the level of celebrityness or whatever, gets paid the minimum, right? While folks who with a higher name get $10,000, they get their money before they provide their resource or talk or whatever. But it's paying the people, paying equitably, right? Like when we talk about abolition, we also take in these these systems of payment into the work, and it's like we're not paying people equitably for their experience, right? I'm a doctor in my experience, right? I may not have the education experience that folks would like me to have, but I have the lived experience, which makes me the expert. So why am I paid the least? And why am I being accommodated the less or thought of at the end? I feel like it's like allowing those directly experienced to set the agenda, right? Like, what does safety look like? We did this like campaign a few years ago at this organization that I work at, and it was one having a conversation with those who are actively engaged in or formal sex workers or what they yeah or former sex workers, but also folks who are at a higher risk of acquiring or becoming HIV positive. And so we study like what does criminalization, stigma, and harm reduction look like in your life. And then we put it in like this graphic where folks was able to understand it. And then the question was prompted back to community. So not only are we having these conversations amongst folks who are directly experienced, but also as we're projecting out into community to do this positive education campaign, is like we all need to think about like how we can assist. What does harm reduction look like? How does criminalization show up in your life? What support looks like, right? And so it is like centering those who are deeply experienced around the issue or directly experienced, and also putting out messaging that reflects what those folks are saying is the way of safety for us, right? And also pulling that information back. When folks feel like they are included, it shows, right? You don't have one or two people who are a part of a collective who are directly experienced, but it does show, right? Diversity is a real thing. And so how we create our coalition spaces, how we strategize our lobbying or advocacy efforts really starts from the root of those who are deeply experienced. And also, and this is a real thing, and I was talking to my friends this morning about this, and I'll be quiet after this, is I use the reference of a highway, right? And on highways, there are several lanes to go one way. And there are two ways to go. You can either go this way or go this way, north or south, east or west, however you want to put it. However, each road is going forward, right? And so if we allow space for folks to own their expertise, we're able to move smoother to our end goal and never see anyone's strategy or idea as a problem. However, we understand that that is a point of view from that individual. And to go back to what Max was saying earlier, is that every perspective is important, right? Including those who are directly experienced, right? And also, if we talk about criminalization, the conversation should be those decarceration experts, those who are policy experts, those who are fundraising and development experts, or communication experts, how we put our messaging out, right? All of those folks are important. So it is including those who are directly experienced, and also structuring spaces where the lived experience is centered, and also we're validating everyone else's expertise.
I think that when I think of this question, the like changing the framework helps me, that like it is not a matter of making space for folks most impacted, because like people engaging in sex work, Black and brown folks, especially trans women, like are making the space and doing the work. It is the like, how can we take resources and capacity and bring it to those spaces, like where that work is already being done and led, and how can we like bring the broader movement and like funders to those spaces too, to like invest in that expertise. And one of the things I think of particularly here is like being expansive in how and where we're doing the work. That like, you know, we started our HIV modernization work at the legislature because that is sort of the policy model that we see across the board a lot, even though we know it is a long game and it's hard. And as we have worked in coalition and community, like get to do the work of thinking like where else we can push. Like in a place like Oklahoma, that means like thinking about tribes that have criminalization on the books and like how we make deeper connections with our tribal colleagues. It is thinking about like talking to district attorneys and county commissioners and defense attorneys, like who are all of the people who can help us think about where and how we disrupt use of what is on the books or track when it is used to start that disruption. How can we think about medical parole and like pardon and parole for folks who have been criminalized for their HIV status, and that like we get to think in those expansive ways because of like following the lead of people who are doing the work, because of Black and Brown and Indigenous folks and trans folks who are leading there. And I think that like the other way I think of showing up and how we sort of make that space and shift those resources is thinking about like where I can push within my community of like allies and comrades, that particularly in queer and trans spaces, when there are discussions on HIV, decriminalization, like those rooms, typically in my experience, are like 90+% Black and Brown and trans folks who are already doing the work, oftentimes at organizations with like not enough investment in their leadership there and not enough buy-in. And so part of it is like pushing like queer folks and like white-led queer orgs to like pick the work back up and dig back into it, not in a way that seeks funding for their organization, but invest resources into the communities who are leading the work. And that one of the other pieces I think of here often is just that like never making the assumption about someone's impact or why they show up, or like demanding those stories to validate their expertise. That like oftentimes I will be in spaces where like folks have been showing up in the work for a while, and it takes a while for them to like share a story about their lived experience and why this matters to them and why they're showing up. And so I try to not discount someone's expertise if I don't like know their why yet or don't know what their experience is. And that is like a piece that is always important for me too, is thinking about like who is at the table already that is impacted, and that's why they're showing up, even if they are not in a space where they feel comfortable to share that yet. And they may never feel comfortable to share that. And how do we still make space for them to show up meaningfully?
I didn't have much to add. I think they gave absolutely wonderful answers to both to that question. I think one thing I would just add is make sure that you do the outreach to those communities in an authentic way, and don't tokenize folks, is was already like just brought up here, and also even the folks that got the letters by not hiding their names and all that stuff, they can do a lot of learning too. And that and sometimes that also means like taking the time just to humble themselves to actually hear from the people that are most impacted, and making sure to have space for that. And I think that there's like ways to make sure, again, when you're creating the coalition, having the principles in a way where you're definitely uplifting people that are most impacted, and we're not just giving most weight to those that got letters by their name. So I think doing that in the early part of the coalition and doing the proper amount of outreach to communities most impacted is some of the most important work to be done. And it also may take longer, and that's also okay.
Absolutely. It takes time to build that trust-based relationship. And I'm glad that you named the need for genuine outreach that uplifts and disrupts the power dynamics, doesn't just perpetuate that sort of unequal transaction. So I want to definitely take some time to explore about building, but I want to offer, if folks have any questions, please feel free to add them to the chat. We do have some lined up for the audience section. At this time, though, I'd like to just focus about, that building. Abolition is about building as well as dismantling oppressive systems. Sorry, building new systems as well as dismantling old oppressive ones. What are some examples of non-carceral responses that do not further stigma, mistrust, and criminalization that folks have come across?
I guess I'll go. I mean, I think that it's the non-carceral response of that looks like community-led crisis support, folks that need, peer networks that offer safety planning without judgment. It's like mutual aid structures. I think that COVID was a prime example of how we can show up for each other, and we continue to. And just to go back to what Cole was saying, is that these larger organizations don't just collect all the funding without redivesting it back into communities that definitely deserve and need it. It looks like housing that doesn't require surveillance, right? I think it's, for me, it's like healthcare that doesn't treat people like a risk. Uh, I'm a big fan of like restorative process, restorative justice, and transformative practices. And I love healing, right? I hate punishment, right? We need to do more healing that comes from a portion of accountability that doesn't lead to punishment. And I think that the approaches of any of these things build trust within community, it strengthens community bonds, and it addresses conditions that actually shape like health outcomes, right? Increasing the quality of life for our people, that doesn't just funnel money into large organizations or visibility for large organizations, but grassroots initiative that continue and always have been the lead on all of these issues or movements.
Just to add off that, for me, it is one of the things thinking about like transformative justice as a way to think it's a different framework from the carceral system. I think that's always important. I've also seen that doesn't mean it's easier, and it doesn't always feel good. As a person who has also done harm myself and gone through some of those processes, understanding that there's harm that you do to the individuals, and there's harm that is also done to the community that was impacted. And this is one thing I was like, we've been doing like the carceral thing thousands and thousands of years. This transformative thing with, different pockets of it have been done for years and years, but this, the greater framework is younger. So there are things that we don't always get right within it. And I do think it is important for us to think about how in which those systems are able to be given more access and support. I think about like the PASS program in Atlanta, and some others of like being able to not have folks have to go to the prison jail for things that they've done, but actually finding other systems for people to get reform and support. I think those are like some of the most important things, and they need to be resourced to be done well. Right? We spend a lot of money on police and prisons to do that system not actually get most of the goals I think that people believe that should come out of those things. So we actually need to put more resources towards transformative systems and making sure that people are able to actually do that. And it also takes time to unlearn all of the carceral things we've done. Like I think about a lot of this. I hate how many police shows are on television, and or like shows that like glorify different like people being in prison. I think that's I think there's some things that we can think through to be able to advocate for those and bring more access to that, while also fighting back against the horrible system we're dealing with right now.
Yeah, I think that I know when I have abolition conversations with folks who don't see themselves as abolitionists yet, right? Like oftentimes the struggle is that if we tear this down, like if we remove the system, the like what do we do instead? And I think that so much opportunity like exists in that space of imagination and the like how do we show up for one another instead? And so I think of our Freedom Oklahoma team. I got to lead a series that we did in some like virtual spaces and then did a social push around called the Solidarity Sessions to like think about for folks feeling some urgency to do something, like how do we think about like what it is to actually build sustainable community and how do we get that as local as possible? So like, you know, how do we have abolition conversations like with our neighbors, like with community members who live nearby about like how we're going to respond if something happens in ways that don't engage the police? Like how are we practicing that as close to home as possible? And I mentioned this earlier, but I think the other part for me that has been useful is the like thinking about like abolition as a holistic and restorative process in the way we approach policy too, so that it's not just a repeal effort, but for us it has been a like repeal and repair effort. That the bills have included what does it look like to then offer a pathway to justice as urgently as possible for folks who have faced the harms of the carceral punishment that exists on the books for their HIV status. That like part of practicing abolition is the like, okay, how are we not leaving behind the folks who have already been or are currently experiencing harm from these policies? And I think that like the other piece of building here is the like thinking of what can we do instead and how can we do this in ways that are as culturally competent as possible. So like our work in Indian country has been really important across the board. And I think is a place that offers us a lot of opportunity, that we have tribal governments who are willing to dig into the fact that HIV criminalization exists on the books and have conversations that like our legislators are not there yet, right? They have a greater understanding of HIV and the long history of stigma and how these things end up being criminalized, and like want to have conversations about what it looks like to change that. And I think doing that in ways that like center like the language and values of communities we're working within. So like we got to talk with Cherokee Nation this year, and Chief Hoskin like posed our conversation within like a Cherokee value of like we all care for one another. And I think that thinking about how we root this work like in community values is a piece of that building that's so important.
Absolutely. Absolutely. Thank you all for sharing those thoughts and participating in this conversation. At this point, I want to transition to some of the audience questions and bring on, there's Max, Katira and Jada as well to answer. The first one we have is about PJP partners, actually. So are there any opportunities for getting involved with PJP, like a CAB or advisory board or advisory group? So community advisory board or advisory group. Where are the spaces for activists and advocates without organizational affiliations to participate and build coalitions?
Yeah, so I'll answer that. Currently, we are building a coalition of nationwide partners that is filled with coalition members, our coalition members, the states we're in, national partners, regional partners, and we don't necessarily require people to have like an organizational affiliation. So we're we're figuring out how to expand that and like decide like who needs to be at the table. And it's basically how you describe it, kind of like a community advisory board where you have a group of your peers who are working in HIV decriminalization, and to share resources, thought partnership, strategy, so we can create a world without HIV criminalization, as well as provide feedback on CHLP's resources and the things we're doing as well. So we're in the new year, we're looking to figure out like how we want this formation to look like and who else needs to be involved. So please be on the lookout for that. As well as there's always opportunity to be the first, to be the person to create the coalition in your community. People are always hungry to like get involved in the work. So if you are in a state where we have a coalition already, I invite you to like reach out to us so we can connect you with that coalition and things like that.
Thank you, Katira. I want to use these last couple of minutes to just end with one final question. Would love to hear y'all's brief response. But first, I want to just thank everyone who has joined this conversation. I know folks might have to hop off now, but we hope you've enjoyed this second installment. We will continue with the third installment of the Abolition for Our People series in January, when we will turn to the topic of authoritarianism and the fight for public health justice. CHLP's Amir Sadeghi will join us in assessing the landscape and digging into the intersections of public health, data privacy, and state violence. And then tomorrow we have another webinar hosted by Kay Greenberg, CHLP's Kay Greenberg, the last webinar in our World AIDS Day Week programming. This aging webinar will explore the impact that criminal records can have on a person's ability to age with dignity. We'll talk about practical steps people can take to clear their records and take advantage of these record clearing resources. And so for a final question from folks on the panel, what would you say to an advocate who is on the fence or curious about abolition?
I'm happy to jump in and say that I would tell them to like invest in doing their own research and reading and learning. I think that can be, it's one thing to hear like quotes and language thrown around by other people. It's an entirely different ballgame to me to go in and educate yourself and see what resonates with you. No one is expecting you, if you're not an abolitionist, to identify as an abolitionist overnight. But I think even taking those steps to understand this framework and why it's important and why we should be utilizing it are vital to our movement. So that's what I would say.
My answer to this, and thank you for that, Jada, is police and prisons don't solve crimes. Police and prisons don't necessarily keep the communities that are most harm and definitely don't keep communities that look like me safe. Abolition, if you take the time to really get into it and learn from it, gives an opportunity for something new and something that is much more, I think, community-led and people-led to actually get to the liberation that many of us want to see.
I'll just say that abolition is a daily practice, right? And so I feel that folks feel intimidated about it because they feel like they need to have all of the answers at first, right? And so you don't always have to have the answers to start moving differently, right? It's a daily practice and it starts within ourselves.
think that I would let folks know that like being an abolitionist isn't a requirement or prerequisite to being part of this work. I think that right, a lot of people move to abolition if they aren't already there in this work, and so making space for folks to show up from where they're at. I'm also usually the person who's then going to offer like reading recommendations or like a follow-up conversation based on what their holdups might be. And I'm going to drop another link in the chat. Maury Turner on our team wrote a really great newsletter for World AIDS Day. And I think the like personal story piece is always important to me to thinking about like people's own journey and reminding them that like none of us were born abolitionists for the most part, right? That like this is often a process of learning and unlearning a lot of the ways we were socialized, and that there's opportunity for them too.
Katira, any comments you'd like to add?
Sure, I'll answer the question. I think if you're curious about abolition, I think you're curious about what is a better way for us to like exist. Like we've seen that like so much does not keep us safe. It actually brings us harm. And so I think if you're curious about abolition, that like you're feeling like you care about humans. And as one of our partners and member of the Maryland Coalition for Modernization, Melanie Reese said that the only way to exist on this earth is to be abolitionist.
Beautiful words from Melanie Reese, and I think really speaks to how we're all learning through this process, and we seek to build a world where people are met with resources and support and not punished for their health status. So thank you all again for joining us today. Really honored to be joined by Naima, Cole, and Max, especially my PJP team as well. So thank you all, and hope everyone enjoys the rest of the day.